Hey guys, it's Dr. Dermatologist I, board certified dermatologist. Welcome to my YouTube channel. Thank you for watching these skincare videos that are educational, never skincare advice, but more skincare education and dermatology education. I'm a dermatologist here in the Seattle area. I practice medical, surgical, and cosmetic dermatology. And I've had this channel for about 4 years. So thanks for having fun with me. Today is going to be the top 3 skincare tips that my patients wish they knew earlier. Maybe skincare pearls or even just facts, right? Because you come to the dermatologist and there are a lot of things that can surprise you. Like I can look at a reticulated violaceous brown rash on your legs and ask you, do you have a space heater at work that you're having blasting on your legs, or heated car seats? Because this is a rash called Erythema ab igni, and it's from chronic heat exposure. So those types of things, I can look like a psychic and people are like, well, how'd you know that? I'm like, I have to know everything about the skin, hair, and nails. But you know, it's a fun job. I love playing detective, but today's gonna be more practical tips for the masses because we're gonna try and keep it applicable to different age groups. So the first would have to be the most important is my patients universally have all wished they wore sunscreen religiously or just wore sunscreen in general. I'm seeing a lot of bad videos out there talking about how sunscreen causes skin cancer. And with the rise of sunscreen use, we're seeing the rise of skin cancer. That shows no causation. Just because there's a correlation between increased sunscreen use and increased incidence of skin cancer, you can't say that the sunscreen is causing the skin cancer. No, what we do know is that the UVA and UVB rays outside can cause DNA disruption, DNA mutations, kinks in our DNA that will lead to tumors down the road, whether it's basal cell carcinoma, which is the most common skin cancer, basal cell carcinoma. That is squamous cell carcinoma, which can be quite aggressive, but it's very, very common. And the less common, but very fatal and serious skin cancer is melanoma. Malignant melanoma I'm seeing quite a bit, even in the Pacific Northwest. And my patients who I diagnose with skin cancer, most of them say, I wish I wore sunscreen earlier. And I can say after treating multiple patients, hundreds of patients a week for the last 10 years, I can say that most of my patients with skin cancer did not grow up using sunscreen, right? And a lot of them still don't wear sunscreen. I actually caught one of them still doing indoor tanning. One indoor tanning session can increase your risk for melanoma by 20%. If you have multiple blistering sunburns, say 5 blistering sunburns in childhood before age 18 or 20 years of age, that can increase your risk of skin cancer or melanoma by 80%. It can even double your risk of melanoma by having 1 blistering sunburn according to one source. So you want to avoid blistering sunburns as much as possible. I say go for SPF 30 and above and reapply every 1 to 2 hours. If you're going to go work out or jump in the water, you want to do a water resistant sunscreen. It's either water resistance 40 or 80 minutes. Look at the label and reapply either 40 minutes or every 80 minutes if you're in the water that long. I'll have a link down in the description for my video going over water resistant sunscreens. Please check that out. So universally, my patients with skin cancer have all wished they have worn sunscreen. Not just for skin cancer though, we also struggle with the manifestations of chronic sun exposure over years. And so not just from a skin cancer standpoint, but also from a cosmetic or aesthetic standpoint, a lot of my patients wish that they protected themselves from the sun early on. And looking at the skin of your inner arm versus your outer arm, you can tell there's a big difference in quality, wrinkles, crepiness. Chronic sun exposure can cause brown spots called solar lentigines. Solar lentigo is a freckle from the sun. If you have lots of sun damage, you get dermatoheliosis and you get reds, you get thinning of your skin, you get easy bruising on the back of your arms where you might need an Arnica-based lotion to help with the bruising. Maybe a retinol-based lotion to help thicken up the skin over time, like Versed and Naturium will have those retinol lotions. But over time, your neck can also change. I did a neck video a few weeks ago too, talking about how chronic sun exposure can cause this thing called poikiloderma savate, where you have red, white, and brown discoloration on the neck, but it spares right under the chin where the chin kind of protects and shades that area of the neck. So sides to back, you can get those changes in skin pigment. Also on the back of the neck, you can get these polygonal geometric shapes on the back of the neck called cutis rhomboidalis nuchae. And that's from chronic sun exposure. You see those in patients who have been on the sun, working on the field, say like my ancestors who were out in the plantation fields back in Hawaii, they would get a lot of that cutis rhomboidalis nuchae just from chronic sun exposure, just hitting the back of their neck. Also, truck drivers and people who are driving a lot, they're not wearing sunscreen in the car. You got to protect your face from UVA radiation, especially the radiation that comes from the side window. So in the US, we drive on the left side of the car, and I see a lot of skin cancers and pre-skin cancers on the left side of our face. And before there was AC, my patients would have the window down and have their arm out. I find a lot of skin cancers on the left arm in the United States. So just keep that in mind, wearing sunscreen while in the car. So that's number one, is sunscreen and avoiding sunburns. That's so huge, okay? I want to start off with that. The other thing I wanted to mention, that if you have a history of pre-skin cancer, skin cancer, sunscreen, I do recommend ISDIN sunscreen, which has Eryfotona actinica, which is a botanical ingredient. And you might see in the ingredient list on the sunscreens, plankton extract. So the plankton extract has the DNA repair enzymes in the sunscreen to help decrease the risk of developing skin cancers and help repair those DNA mutations. We want to snip those out as much as possible, but as we get older, we have a less efficient system in taking out those mutations, and the system gets overwhelmed, and that leads to tumors. So I recommend the ISDIN, the tinted or non-tinted, the Eryfotona ageless sunscreens. Those emulsion sunscreens are very good. Just shake them up well to distribute the UV filters evenly throughout before applying. Number two would be not considering a retinoid sooner. So I have a lot of patients who are asking me about Botox, a lot of them asking about retinoids. And I always say it comes down to skin integrity, that the quality of your skin is so important, because if the skin quality is not good, say the paper is very wrinkled and you crumpled it up over time, it doesn't matter if you take away muscle movement. Say if we do Botox and we take away the muscle movement that causes wrinkles, that's called dynamic retids, where we make a frown or we lift up our forehead and we get wrinkles with expression. If we take away that muscle movement and we still have wrinkles at rest because the quality is bad from sun exposure over time, then Botox, I tell patients straight up, like, I don't think you're a good candidate for Botox. You have to look at the integrity. So retinoids are important. If you're not pregnant, you want to try and consider a retinoid. And there are different types of retinoids. There's vitamin A derivatives, and the pill form is isotretinoin, which we give to patients with moderate to severe acne, that's scarring or cystic acne. And that pill, we are very strict with females, because if you get pregnant on that, we have to really worry about baby having birth defects, because that's too much vitamin A for a fetus. Now, as a cream or a serum, I say patients can do that if they can tolerate it. The skin irritation is what I worry about, but just in case, if you're pregnant, don't apply it topically. Being pregnant is such a special, fragile time. You don't have to do any of those extra creams, okay? So starting on a retinoid, I always say, if it's not for acne, consider it in your mid-20s and up. A lot of my patients in their 50s and 60s are starting to consider it, and they ask me on my way out, what are the 2 things I can do for my skin, doc? What are the things I can do? Always sunscreen during the day, retinoid at night. Consider a retinoid. So there's over-the-counter retinoids like retinol, retinaldehyde, which is more potent than retinol. Retinaldehyde is one conversion step away from prescription retinoic acid, which I prescribe, called tretinoin. It's more potent than retinol, but less irritating than tretinoin. But tretinoin's great. It has been studied for many years, and it's been shown to help with increasing collagen production, helps bring in elastic fibers, helps bring in new blood vessels to improve your complexion, your skin tone, helps increase cell turnover, so it helps with dark spots, and it helps keep your pores clean. So a lot of my patients just wish they started on a retinoid sooner so that they can start improving the quality sooner. Now, I might have patients on it in their teenage years for acne purposes, but if you don't have those issues, you're not seeing a dermatologist, consider retinol in your mid-20s and up. Okay, earlier than that, you don't have to worry about the fine lines or wrinkles. Just wear your sunscreen is all you have to worry about in your teens or your childhood, okay? So, there are different types. I talk about a lot, the CeraVe, Retinol, Olay 24, all great options. I like to use the AlphaRet by SkinBetter Science, and that's a lactic acid paired with the retinoid. And head-to-head has been shown to be non-inferior to prescription tretinoin. So I like that one a lot. You get exfoliation, plus you get the glow up from your retinoid. So it's just a nice combination there. Be sure to moisturize after using your retinol. I usually recommend applying that at bedtime, because a lot of retinoids are sensitive to sunlight and can become unstable and deactivate in sunlight. So I always say use it at bedtime. So that's number 2, patients who wish that they knew about this magic cream, because that's really such a common question. At the end of the skin visit, when I'm about to go out this door, I run my hands on the door handle. They're always asking, but doc, by the way, what can I do for my skin? So it's always sunscreen during the day, retinoid at night, and then exercise twice a week, resistance training to increase collagen production. Last year in Nature, they published this Japanese study that showed that women in their 40s to 50s who were sedentary, when they started increasing activity and doing 2 times a week, 1-hour sessions of resistance training, they were able to increase the collagen density in their skin and to reduce wrinkles. So I always tell patients that little tidbit too. Number 3, acne scars. Acne scars are so tough. I see this so much in my clinic, and I always feel bad for my patients, young and older, who struggle with acne scars. And this is a big regret that they wish they knew. What could they have done? Things that, should they have seen their dermatologist sooner? That's always one factor. Number 2, should I have picked so much on my acne? And I do have acne scars on my temples that I've been working on for many years, and I have chemical peels at my disposal. I have skincare at my disposal. I sometimes will, demo some devices like radio frequency microneedling or an ablative laser. So I have those things, but it does not take away the scars completely. Scars are permanent when it comes to acne, and it takes a lot of money and a lot of time and technology to reduce and make them, kind of disappear. So I've been able to work on my scarring over the years. I thank retinoids. I thank sunscreen. Retinoids increase collagen. Sunscreen will decrease the chances of the sunlight eating up the collagen around my acne scars and help prevent hyperpigmented scars when I get acne. So consider retinoids. If you do have acne, definitely see your dermatologist. I'd say go for a good acne cleanser to start off, like salicylic acid. And there are different salicylic acid cleansers out there. CeraVe makes an SA cleanser. They also have another acne cleanser that came out more recently. That's really nice. Cetaphil has done a great job with their salicylic acid cleansers. Neutrogena, and even the K-Beauty brand CosRx. I like their salicylic acid cleanser quite a bit. Or you can consider benzoyl peroxide. Benzoyl peroxide has been under, the microscope for a little bit in the media recently, with ValueShort coming out with that study saying if you heat up your benzoyl peroxide in a hot car of 155 degrees Fahrenheit for 18 days, it can turn into the carcinogen benzene. They found in a recent study, just an update everyone, that a recent study showed that people who don't use benzoyl peroxide versus benzoyl peroxide using patients' blood levels of benzene are no different. So if you're using benzoyl peroxide out there, you can go ahead and use that. Right now, from what we know, it doesn't seem like it's dangerous unless you're heating it up. So keep it in a cool place. Do not keep it in a sauna or a hot car, which most of my patients are not doing. They're keeping it in their bathroom, does not get that hot, and they're going to cleanse their face at their bathroom sink, right? So those 2 ingredients are great for acne prevention and treatment. Number 3 is a retinoid. And then the other thing to consider would be pimple patches. I'm okay with pimple patches. If you're using an occasional pimple patch to protect yourself, your finger, from picking at that acne lesion, I'm all for it. So the Mighty Patch, CosRx, Zitstica, Neutrogena makes some pimple patches. Those are all fine to use. Those hydrocolloid patches that prevent you from picking at them. Because I can tell when a patient has been picking. I see this angulated, triangular shaped scab on the forehead, on the cheeks. I can tell when you're picking, and those are really tough. Those atrophic indented scars that you develop there, those are so tough to treat, right? So even lasers, we have a hard time filling in those indented ice pick scars. So try your best to not go after them, using a retinoid to help prevent acne. But retinoids can also help with acne scarring as well over time. Doesn't happen very quickly. Has to be something you work at over many months and years. So those are the top 3 things my patients have said, I wish I knew this earlier. I'll keep doing these videos if you guys find them helpful. Please leave some comments down below or questions, and I'll try to get to them when I can. But thank you guys for tuning into the channel. Every Saturday morning, I'm coming out with a new video. So I'm going to try to keep that up. And please share this video with friends who are into skincare with dermatology questions or concerns. Please hit the subscribe button. Please hit the like button. And I'll see you guys for the next video. All right. Peace.